Hey guys, my name is Johnny. I'm the site supervisor here at Riverside ACSU, which is the Adult Crisis Stabilization Unit with Mountain Comprehensive Care. I've enjoyed getting to work with Miss Melanie here. She's had a really good chance to really learn a lot and really get to soak in a lot of stuff on her practicum experience. I've really tried to be involved and get her, with as many things as we can. So she's really kind of got her sleeves pulled up and diving into a lot of stuff. So what we'll do is, kind of talk about the program, touch on the program briefly, and just kind of what she's been doing with us to help us in her practical journey, as well as kind of give a tour of the facility, maybe speak with some of the staff and other clinicians, and just really kind of give you guys a showcase of, what we are and what we do. So like I said, we are an adult crisis facility with the Mountain Comprehensive Care Center agency. And Mountain Comprehensive Care, if you didn't know, is one of the comp care regions in Kentucky. We primarily cover the Pike, Floyd, Johnson, Martin, and McGoffin County region. However, we are spread through all parts of the state. We have clinics in Maysville, we have clinics in Ashland, we have clinics in Paducah, Winchester, Lexington, Harrodsburg, all over the place. So Madisonville, we're really spread out. So really growing as an agency. But for general purposes, we are the home mountain region of those 5 counties. Now, the CSU basically is a crisis stabilization unit, as I said. Different facilities, programs, agencies, comp care regions, etc. may have different styles, I guess, how they run their program. Our facility is more ran like a psychiatric inpatient facility. It's more focused on the psychiatric crisis. I know some facilities focus more on a homeless crisis and it's set up more like an emergency shelter or homeless shelter. Our program is basically run like a inpatient mental health facility. So we do a lot of medication management, psychiatric evaluation, individual therapy, group therapy, try to connect a lot with resources, case management type stuff, whether it be housing or whatever the needs are. So each client that comes into the facility, we really try to take that as an individualized approach, work on what that client's needs are, what they really want out of the experience, and try to help them any way we can. The typical experience is 3 to 5 days. So our program, usually the clients come in and they can expect to be here for at least 4 or 5 days. During that time, we will do a lot of therapy. They will see the provider, maybe get started on some meds or have some med changes. And we'll work a lot of other things while they're here, whether that's structured activities, whether that's case management type stuff. We really try our best to really, get the client in a position to where when they leave the facility, they're going to be in a lot better frame of mind mentally than when they got here. Hence the term stabilization. We want to get them stabilized and get them back out to where they can follow up outpatient or get back to work and get back to their daily lives without any complications. Now, we see a lot of cases. We see some of the more severe cases, whether it be suicidal ideations, some psychosis, paranoia, delusions, and things. But we also see things on the other end of the spectrum, somebody that's just got a lot of stress in their life, or somebody that just needs to get away for a few days and just kind of get out of their environment. So we see a broad range of cases that way. Like I said, we take each case individually and we just kind of work with it the best we can. But from Melanie's standpoint, she's really been a really good observer. At the bachelor's level in this program, that's going to prohibit her from actually being hands-on as far as the clinical duties and doing therapy and doing some of the documentation and things like that. However, she does have a chance to get to observe a lot of the things we do here, whether that's the policies that we have, whether that's assessments, treatment planning, actual clinical stuff. We also have a crisis hotline on site that runs 24/7 as a crisis hotline. So she's really got a good experience as far as being able to observe the crisis setting and what all that entails. So it's really been a great practical experience for her. I've really been glad to help her with this journey. And, we'll kind of give you guys a better idea as we go. And I guess we can go maybe do a little tour. Okay. You guys on the phone?
Nope.
All right, so this is our crisis hotline office. Basically, like I said, 24/7. This is Miss Tammy, and this is
Hello.
Miss Linda.
Yes.
And so basically, they're crisis line operators. We're also a part of the National Suicide Prevention Hotline. So the Lifeline, or National Suicide Hotline, basically rings in regional, and any calls we get in the region from the national line gets routed here, or anybody that calls our direct number. And so it's a really good asset to have. It's a good asset for the agency. It's a good resource for any of the clients in crisis. They can always call and we can help, whether that's, get them the help they need, be somebody to talk to, and do the therapy over the phone, whatever we need to do. So it's a great asset to have, and I know these ladies do a great job at what they do, and this is something Melanie's also got a chance to be a part of, is to sit in with some crisis calls and kind of observe how we do things as far as the crisis hotline is concerned. You guys have anything to say or anything you want to put in?
No.
All right.
We like being here and doing our job, and you're nice to meet you.
Nice to meet you. Thank you, girls.
Okay, now what we're going to do now is move more into the adult facility. And again, there may be some clients, so obviously confidentiality is concerned, but basically this is the central hub of where we locate out of and where a lot of clinicians do their work. We have a camera system, if you want to see that way, we can kind of keep an eye on all the clients and to make sure everybody's where they need to be, and it just really kind of helps from that kind of aspect. Like I said, we do a lot of our intake assessments in here. We do a lot of our treatment planning and different things in here. So it gives the clinicians a nice little space to work on a lot of their clinical documents and the things they need to do to serve the clients. But going out more into the facility, this is our living area that we have that the clients can kind of relax. They can watch TV and just kind of, enjoy treatment, but be more in an at-home environment. When you're at a hospital or another setting, obviously you're in a hospital setting, the thing we like to offer the clients is a more therapeutic environment, a more laid-back atmosphere. So that's one of the things that the living area really helps with. Another thing, we also have a kitchen. We do all of our own meals here on site. So
It's kind of messy at the moment.
we just got done with dinner, so it's probably not as clean as it normally is, but 3 meals a day, breakfast, lunch, and dinner. We also have snacks and other various things. So like I said, all meals are on site. We do all that, specifically for clients. We do have different menus we follow by. If it's a diabetic menu, we got to go by, we do the diabetic menu. And then we have, our dining area. We just kind of, like I said, keep it simple, keep it more at home, that way it's kind of like a homely environment. And if you want, we'll go back and we'll kind of look at the male wing. Okay, this is our male wing. We have 4 male, something I should mention, we have 4 male beds, 4 female beds in the facility. This is a good example of what one of the beds look like. Just basic things, chest, drawers, bed for the clients, but they're more than welcome to bring some personal belongings with them, whether that's items of clothes or certain things, but we try to limit that as much as possible. But, this is a good, idea of kind of how the rooms are set up in the facility. So like I said, 4 male beds on this side. And then we have, male bathroom for them to shower, use the restroom and things like that. Another asset to the facility is we have our own evaluation room. So this space basically comes in handy. Anytime we may have somebody that's brought in on a warrantless arrest citation or a 202A for involuntary hospitalization, the police or family members or whatnot can bring their relative here. We can have a consultant come out and meet with them and evaluate them and determine where we go from there. Same thing after hours. We serve as an after hours location 24/7. If somebody comes in and they want help and they don't really know where to turn to, they can come here. We can have an evaluator come out and determine whether they're fit maybe for the unit, or maybe refer them to a higher level of care, whether it's a hospital or even follow them back up with outpatient or wherever. But it just serves as a great meeting point, whether it's after hours, weekends, since we're open 24/7 a day. This basically serves as a good point just to get clients in and to meet them and to try to help them and move them on to that next level of care. So going back into the facility, we'll probably head back around and get another tour on the female side. Okay, another asset that we have. It's a little rainy, the weather probably not cooperating as much, but we do have an outside area. This is a big draw for a lot of the clients. A lot of the facilities don't allow them to go outside. You can't smoke. It's a lot more restrictive. So we offer a smoking area, and then in the summertime too, we have some cornhole boards, some things we try to do with the clients just so they can come out, get some sun, and get out of the unit, I guess. You're not outside the unit, but again, you're outside. So a lot of times that's just as therapeutic as anything. So that's something good that we have going for us.
You messed up big time.
No, they got it over in their house.
Okay. So another place that we get a lot of time in, and another place Melanie will get to spend a lot of time in, is our therapy room. This is where we do a lot of our therapy, a lot of our group therapy, a lot of our individual therapy. And as you see, we try to make it as comfy as we can with the couches. That way everybody can come in, relax, and they're not in a doctor's office, or they're not in an office to where they feel like they're uncomfortable or whatnot. They're, it's just a more relaxing place, therapeutic environment to do a lot of the therapy. So this is where a lot of the therapy takes place, a lot of the group therapy, a lot of the other things we do here. We have, TV to where we can do videos and other things. So this is a really good area that we like to utilize and really work a lot with the clients in. Okay. Coming to this part of the facility, we won't actually go in and take a look. But in here we have our medication room. It's locked up at all times, but this is where we administer the medications. If we do anything health related, whether it's checking blood pressures, blood sugars, things of that nature, we handle all that inside this room. And also we're the central hub for the mountain region, a lot of the waste disposal. So if there's any kind of waste disposal from any of the sides or medication disposal, this is the central location. We keep that locked up in, and then we dispose of it for a third-party source. And last but not least, we have our female wing. So again, it's set up very similar to the male side. If you want to take an example of one of the female rooms, very similar to the male side. Just very simple. Again, 4 rooms each, and basically that's it. That's the grand tour.